Dus dat was het probleem. Streaming, nee, wat daar doet het hele balkje loopt nu wat meer vol. En dat is gek als dat inderdaad zo.
Hello everyone, Philips is proud to be a sponsor of the European Resuscitation Conference 2020. My name is Dawn Jorgensen and I'm a principal scientist with Philips. And alongside me is Satyan Vandernathan, our Director of New Business Development. I'd like to start by thanking you for joining us today. We have a fantastic presentation by Tom Coy, the Director of SUCCES Global, on how to launch a successful community response program. Let's make this session as interactive as possible. If you have a question, please go ahead and type it in the chat window, and we'll come back to it at the end during the live Q&A. Let's go ahead and get started. Thank you.
Heart diseases are the greatest killer amongst the non-communicable diseases, more than strokes, COPD, pneumonia, or lung diseases. Cardiac arrest is a massive public health problem. In Europe and the United States alone, it is responsible for approximately 500,000 deaths per year. My name is Tom Coy, and I have the privilege to introduce some of the latest developments in one of the ways to combat cardiac arrest, a citizen responder alert system. Currently, the average survival rate is around 10 to 15%. A key element in determining this outcome is time. For every minute that passes, survival chance drops by about 10%. A general rule of thumb is that you need to be there within the first 6 minutes to help the victim, for the victim to have a good survival chance. This means that from the moment a cardiac arrest occurs, the clock starts ticking. This puts a lot of pressure on professional emergency services around the world. For example, in the Netherlands, with a strong infrastructure in place, the EMS still needs around 10 minutes to arrive on scene. This is too late. There are several ways to improve the outcome of cardiac arrest. In this video, we will focus on one way, the Citizen Responder Alert System. In the Netherlands, we have run such a system since 2008. We currently have around 250,000 responders in the system and about 25,000 AEDs. It has become a valuable addition to the EMS response and the overall chain of survival. The success in the Netherlands would not have been possible without the close cooperation between several stakeholders. In this video, these stakeholders will share some of the insights that they have gathered over the last 10 years from a technological, organizational and research perspective. Our hope is that these stories will inspire you and provide you with the placeholders necessary to implement your own citizen responder system. Citizen responder programs have been active in certain areas for many years. In others, they are only recently implemented. What do we know about the impact of these types of programs? Remy Stiglitz from the ARREST group will highlight some of the key and latest research around the citizen responder solutions. What is the ARREST group?
The Amsterdam Resuscitation Studies, or ARREST, studies out-of-hospital cardiac arrest within the province of North Holland in the Netherlands. And between 2010 and 2018, we also studied it in the region of Twente in the eastern part of the Netherlands. ARREST is an ongoing prospective registry of all EMS-attended out-of-hospital cardiac arrest in the study region. And the purpose of ARREST is to study which factors determine patient survival and to see in which part of the chain of care there are possibilities for improvements. To this end, ARREST collaborates with EMS dispatch centers, ambulance services and hospitals within the study area, and also with first responders like police, firefighters and Hartslag Nu, which alert the citizen responders. Data from all these sources are combined in one database. Also the data from AEDs, including the ones already on site, like in public places, to analyze the first response treatment of out-of-hospital cardiac arrest in the Netherlands. Another purpose of ARREST is also that we study the potential risk factors of getting a sudden cardiac arrest in the first place. And ARREST also participates in international cooperation projects like Eureka and the Horizon 2020 project of EscapeNet.
What is the impact of citizen responders on AED usage?
From a study of Jolanda Zijlstra in 2014, we've studied the effect of citizen responders in the region of Noord-Holland-Noord, in the province of Noord-Holland. And well, in the Netherlands we had a two-tier system of ambulance dispatch to the victim and police as well as first responder. From there, the citizen responders were added to the EMS response. And we found that in around 12% of all cases after introduction, an AED was connected by a citizen responder. And if you look in those cases, how fast they were with a median time 2.5 minutes faster than the EMS services. And that was about a similar time as the police. And if you look for the cases where a shock was needed to a patient, that in around 11% of all cases, they delivered the shock within 6 minutes.
What is the impact of citizen responders in residential areas?
From a study of Stiglitz et al. From 2020, we found that in residential areas, as soon as the system was activated and at least one AED was alerted in the call, around 21% of all victims had an AED connected before EMS arrival, thanks to citizen responders. In those cases, the time to first defibrillation was significantly shorter than if there was no AED applied. In this study, we also tried to determine how many AEDs and citizen responders you need for an effective system. And we found that within a square kilometer, you need at least 2 AEDs per square kilometer available at any time to have a good chance for that AED to be used at the victim. And at least 10 citizen responders. And well, we found that the more responders you have, the faster the AED is connected and the higher the chance that the AED is connected. So we recommend that you have as many responders in your system as possible, but with a minimum of 10 per square kilometer. We saw that citizen responders were not replacing the first responders. So, like I said, in the Netherlands we alert ambulance services and police already to the site, and now also citizen responders. But the citizen responders act complementary to the police. So they do not replace any police case, but only the slower EMS cases.
What is the impact on responders?
We have studied that in a study from Zijlstra in 2015. In that study we interviewed 189 citizen responders. They received an email with a short questionnaire immediately after the incident. And in that email they were asked about the psychological impact of the incident. And the results show that 13% of the citizen responders had a severe impact after the incident. And when we called them 4 to 6 weeks later for an interview, the impact was reduced to 0. From that we could conclude that after 4 or 6 weeks there were no citizen responders with any signs of PTSD.
Can you tell us something about the latest international outlook on citizen responder programs?
Well, last year there was an international conference in Greifswald, and well, there's now an unpublished paper from that written by Metelman, and different experts were there in a panel to discuss citizen responders and should they have an added value in first response treatment or not. There were different experts from different countries like Germany, Netherlands, Denmark, Austria, and well, they had a high consensus on that citizen responders have a very high potential in first response treatment for out-of-hospital cardiac arrest.
Citizen responder systems take different forms, but usually have a comparable flow. Once a dispatch center determines that a cardiac arrest is happening, it should automatically trigger the citizen responder system. In this demo, we showcase the steps from the moment an alert is received. 3 components will be highlighted. 1. The app that is being used by the responder. On the app, the responder receives the alert and the navigation details after accepting. 2. The display that is active at the dispatch center. This shows a live view of the incident. 3. The dashboard for the administrator. Here you can review the alert after completion.
When an alert is triggered at the dispatch center, citizen responders get notified by app. At the same time, the dispatcher receives an alert on CP Connect. To open the incident, click on Accept to get an overview of the incident. To widen the map, click on the arrow button. The red location pin indicates the victim's address. There are multiple colors to indicate the status of a volunteer responder. For instance, when it's green, a volunteer responder accepted the alert. When it's blue, the volunteer responder accepted and retrieves an AED first. Up following, you can see in real time the progress of the volunteer responders with their actual location. When you click on an icon, you see more information about the responder until the responder arrives at the incident. In the CP dashboard, you can review and evaluate the alert in a later stadium. You can see more information about the volunteer responders and also about the AEDs that were alerted within the incident.
The key to a successful program is the quality of your responder and AED databases. Without responders, there's no response possible. In the Netherlands, the initial approach was through local initiatives, with a close cooperation between the technology provider, municipalities, local NGOs and local businesses. This grew the system, but only slowly. The Dutch Heart Foundation joined this effort in 2014 and played a critical role in growing the responder network in the Netherlands through different national activities. Paul Huguenin is manager of emergency at the Dutch Heart Foundation and oversees the Dutch responder network as part of his role. Can you give a brief overview of the Dutch Heart Foundation?
The Dutch Heart Foundation is a charity health foundation on cardiovascular disease in the Netherlands since 1964. We do approximately 56 million euros income a year by donations and through corporate partnerships. We invest approximately 49 million in research and projects every year. At the moment, 140 people are working at the Dutch Heart Foundation, and we are the #2 health fund in the Netherlands. One of our big aims is to realize with our partners a nationwide so-called 6-minute zone throughout the Netherlands. It means a complete network of volunteer responders and AEDs for national alerting system to beat out-of-hospital cardiac arrest. We're seriously involved in this since 2015.
What was the role of the Dutch Heart Foundation at the start of the program?
The role of the Dutch Heart Foundation? Well, we come a long way. One of our former directors, Dr. Bart Dekker, was the first to stress that CPR can be done by not medically trained people. He started training relatives of heart patients. That was already back in the 70s. At the beginning, it wasn't really a program, by the way. We have to give credits to all kinds of local initiatives that came up around 2007, 2012. At the time, we organized conferences for local authorities. We stimulated local initiators to become a CPR partner of the Dutch Heart Foundation, and we provided them with communication materials. In 2014, we started to work more strategic with the program, trying to realize more impact nationwide. So we started organizing large CPR training events, for instance, at football club stadium of one of our biggest football clubs, Feyenoord in Rotterdam, for their fans. That created a lot of publicity and awareness. And we did a national TV and social media campaign in 2016 and 2017. That had a lot of impact. In all this, we cooperated closely with our partners of the alerting system. At the time, we had two systems. Since 2018, we have one national alerting system, which is also a huge achievement, knowing that it all started with all kinds of different local initiatives.
What was the rationale for investing in the build-up of the responder network?
The rationale for investing in a responder network? Well, we know that a strong nationwide network of CPR volunteers and AEDs and a well-organized national alerting system directly saves a lot of lives. It increases the chance that people survive a cardiac arrest. It's quite easy to understand why we invest in that. Of course, CPR fits very well in our mission to save lives of people who suffer from heart diseases. We knew there are approximately 2 million people who have been trained in CPR. This is a great amount of people who can be so helpful if they know what they can do with that and where they must be to do that. I think the Dutch Heart Foundation has some distinctive qualities that was and is of great value. We have a strong credibility and brand awareness. We know that people are willing to listen to what the Dutch Heart Foundation has to say. We have good press relations, so we can use that to spread important messages. And we have good access to decision makers and partners. We can use that for realizing important initiatives. In short, we can make a difference. We can contribute to society and to our partners in this field. And that is our motivation.
What was the goal of the campaign?
The goal of the national TV and social media campaign in 2016 and 2017 was an awareness campaign to get attention for the importance of learning CPR and of becoming a citizen responder. The call to action was become a member of the network. We developed a breathtaking commercial for the national TV. It had a lot of impact.
Which channels and products did you create within the campaign?
We created an above-the-line campaign on national TV with 3 flights in end of 2015, in 2016 and in 2017. In the last flight, we targeted on specific locations where we needed more volunteers. We used TV and social media. We did CPR events and press events, for instance, a CPR training with celebrities and famous football players. We used flyers, videos, newsletters, advertorials, direct mail, and we used personal stories of people who survived through CPR. Heartfelt stories.
What were the effects, both on attitude and on registrations?
We contributed to a huge success. By the end of 2015, we had 65,000 volunteers in the CPR network. Our aim was to get 170,000 volunteers. We achieved that goal by the end of 2017. By now we have a stable base of more than 233,000 volunteers, and that amount is still growing. Side effect was a substantial raise in the amount of people who wanted to attend a CPR training, 10 times as high, up to 12,000 people. We are very, very pleased with these results.
What is the current role of the Dutch Heart Foundation in the Dutch Responder program?
By now we are one of the board members of the foundation who controls a national alerting system which is called Hartslag Nu. In English, Heartbeat Now. Together we created a great cooperation with the ambulance world, the provider of the alerting system STAN, with training and AED providers and so many local foundations who contribute to the system. It's really great to see how all these different parties with all their different backgrounds work together better and better every day. I think the Dutch Heart Foundation played a very helpful role in this field. But we must never forget that it all depends on the huge amount of people who are willing to contribute to the network and who are prepared to be alerted 24/7 to go to a cardiac arrest victim. Without those great volunteers, the system would be nothing.
What are current investments made in growing the responder network, and what are the next steps?
At the moment we have a good coverage of the responder network. It keeps growing organically. So now our focus has shifted. At the moment we concentrate on closing the network of AEDs in the Netherlands. Together with Hartslag Nu, we created a so-called blind spot map, where everybody can see where we still need AEDs. Currently, we still have to fill 1,600 additional blind spots to achieve full AED coverage. What our role will be in the future we do not know yet, but we work on increasing investments in research and innovation.
Besides building your responder network, AEDs are needed to revive the patient. AEDs are added to the network through municipality investments and by activating local companies and private individuals to make AEDs available. The aim is to have at least one in the alerting system registered public available 24/7 AED within any 500-meter radius. This is a challenging proposition. In 2018, the Dutch Heart Foundation partnered with Philips to start a unique community program to get more AEDs in residential areas. Marianne Spoelstra from the Dutch Heart Foundation will explain this initiative in more detail. What was the status of the AED network when the idea for the community program started?
When we started, there were 10,000 AEDs registered in the alerting system. By far not enough to have a full coverage of AEDs in the Netherlands. And mainly in residential areas, AEDs were missing. And just there, most cardiac arrests take place.
What was the main reason for activating communities in a national program?
Well, there were a few reasons why we wanted to activate communities instead of individuals. First of all, costs. Because if you buy it together, you can share the costs. And another important reason was that we wanted to activate communities, because we wanted the AED available in a community for the entire neighborhood, day and night.
What were the main challenges and what are the main components of the program?
A program where you can share costs is in itself not unique. The challenge is to have it done in such a way that it's easy for people to donate. The other challenge is that you want to do it in such a way that a lot of people are willing to join, because you want community involvement. Based on this, we developed together with Philips Buurt-ID. And that's an online crowdfund platform where you collect money for an AED with your neighbors. The AED package consists of an AED, outdoor cabinet and full service pack. The platform offers you an easy way to collect the money and also to activate your neighbors to donate. And also you can find tips and tricks on the website to make a success of your crowdfunding.
How did you communicate the program?
To create awareness and activate people to start their own crowdfunding, we had national TV campaigns supported by social media activities. And also, we did some press releases and they were widely picked up by local media as well as national media.
What was the initial response of the communities?
To practice what you preach, I started a crowdfunding myself in my own neighborhood. And to be honest, I was a bit nervous because I thought, would people donate? But luckily, indeed, they did. Reactions were overwhelming. People understood the importance of an AED and were willing to donate money. And in no time, I had all the money collected and we now have an AED in our neighborhood. And it gave us a lot of confidence that we had a strong and relevant proposition developed together with Philips. And that was indeed the case, because a lot of people started crowdfunding campaigns.
What are key success criteria?
Key success criteria are first of all preparation. Have a plan before you start your crowdfunding. Involve your neighbors. make a picture that's recognizable for the neighborhood. And of course, when you start your campaign, your crowdfunding, donate yourself as well. Finally, to activate your neighbors, you can share a link to your website via a post in a WhatsApp group in your neighborhood and by distributing hard copy flyers door to door.
What are the results to date?
So far, 2,000 neighborhoods have now an AED available day and night in their community. And that's worth more than 3 million euros donated by Dutch people. Moreover, this program not only resulted in heart-safe neighborhoods, it also generated a lot of spin-off to other stakeholders to take action in many other ways. And altogether, this resulted in the fact that we now have more than 23,000 AEDs registered in the Netherlands.
What are your next initiatives?
Together with the alerting system, we created a map where people can see where there are gaps, where there are AEDs missing. And at the moment we have 1,600 places where there are no 24/7 AEDs available. And given the involvement of all stakeholders and the joint efforts everyone took so far, I am quite confident that we will be able to realize a well-covered AED network by the end of next year.
2020 was an exceptional year with the unexpected rise of the COVID-19 virus. The virus impacted society as a whole, and the citizen responder system was not left undisturbed. Maaike Kaman from Stan Global will highlight how the protocols in the Netherlands were adapted to deal with the COVID challenge. When did it become clear that the general protocols needed to be adjusted?
Well, due to the rising number of COVID infections in the Netherlands, it was no longer clear in advance whether a victim could have COVID or not. And we had to weigh this fact, with the knowledge, of course, that every year over 2,000 lives are saved by the National Responder Network.
Can you describe the parties that were involved in these decisions?
A well-balanced decision had to be made, considering the fact that stopping the alerts would cost many lives. And therefore 4 parties were involved to the decision-making process. First, the Dutch Resuscitation Council was involved and advised to the operational aspects of the protocols. And second, of course, Hartslag Nu, the responder network itself, advised on the operational aspects as well as the technical aspects. The third party was the AZN, that's Ambulance Care the Netherlands. This organization advised on the medical aspects, as well as the Dutch Association of EMS Medical Directors. They also advised on the medical aspects.
What were the main differences between the 2 protocols?
Well, the regular resuscitation and alerting protocols underwent 2 main changes. First of all, the risk of transmission from a COVID-infected patient is very high during the breathing check procedure. It's almost 100%. And therefore we changed the breathing check procedure. The responders are now advised to do the breathing check procedure by only looking at the chest, and they are advised not to come close to the respiration tract or to open the respiration tract. And they are strongly advised not to give mouth-to-mouth resuscitation anymore. In general, the risk of complications due to a COVID-19 infection is considerably lower for younger people than for elder people, and therefore we introduced the second change of the protocol, which is an age limit. Citizen responders that are 50 years or older are no longer alerted by the system. To compensate for the lower number of available citizen responders, we changed the alerting radius, which means we increased it from 750 meters to 2,000 meters. And now, since the change of the protocols, the first 100 available responders within the radius of 2,000 meters are alerted by the system.
What has been the effect of the COVID-19 protocol on citizen responders?
Since the changing of the protocols, we do notice that in rural areas, more citizen responders are alerted, which is good, of course, for rural areas. But to know the exact consequences for the response rates and survival rates, we need to do more analysis on the data we have.
Has the protocol been adapted since the initial change?
After the first rising COVID curve in the Netherlands was flattened, we adjusted the COVID protocol back to the normal protocol from before the pandemic. But now, as the Netherlands is experiencing a rising number of COVID infections again, we needed to reactivate the COVID protocol again. Based on the expertise of the parties involved, the protocol was adapted by increasing the age limit from 50 years old to 70 years old. And due to this adaptation, the number of citizen responders that are excluded from alerting dropped from over 80,000 to just 8,000 citizen responders, which is, of course, good. We will continue to monitor the situation together with all involved parties, and we will adapt the protocol again when necessary.
With almost 250,000 verified responders and close to 25,000 verified AEDs active in the still growing program, you need a robust maintenance program to ensure the continued health of the databases. There is a central help desk active with 3 full-time employees that handle user questions and verify AEDs and responders. However, the maintenance would not be possible without the help of local partners that maintain their own regions. Currently, there are over 80 partners that have access to their region in the system. Here they can add and maintain responders, AEDs and/or questionnaires. Maarten van der Bos is the chairman of the Klop and Hart Foundation in the Netherlands. Can you give us a short introduction of the Klop and Hart Foundation?
The Klop and Hart Foundation is a non-profit organization. It was established 15 years ago. It's the whole area between Arnhem and Nijmegen. It consists of district Lingewaard and district Over-Betuwe. We started in the Lingewaard and then a few years later also in Over-Betuwe. Both districts have about 44 or 45,000 inhabitants. And at the moment we have approximately 250 AEDs available. Most of them are 24/7. And we own 60% of those AEDs. And on the other hand, we have about 1,000 responders at the moment. My role in the foundation is chairman at the moment. I'm also one of the founders of the organization. And on the other hand, I'm also instructor, BLS and PBLS.
What activities do you undertake as a local partner within the Dutch Responder Program?
From the beginning, we had 2 main goals. The first goal was to have as many as possible AEDs available 24/7. And the second goal was how to have enough people available who would like to be trained for CPR. And also how to keep them trained. That was our main goal. So when you talk about the activities, we focus also on those 2 goals. Now, for example, what we do during courses, we explain our people, our volunteers, about the network, how it works, what's going to happen when in case there's an emergency call. So that's one item. And also we try them to be volunteer. And suppose you have a group of 10 people, then about 8 of them will say, okay, I would like to be volunteer, okay, and I will do the registration. But when you do that, in the end, only 2 of them will do this. So we change the system. What we're doing now, we ask those 8 people permission that we do the registration for them. And so they have to sign a registration form, so they allow us to do this, and so we enter in the system, and that's how it works. With regard to the AEDs, I can tell you that we do the maintenance of approximately 98% of all those AEDs. We are also administrator in the system, so we have everything in our hands. We work with one type of AED. So it means that most of them have a connection with Wi-Fi. And it works in the system. Every week there's a self-check of the EAD. And then we get response from the system in our management system. So if there's anything wrong with the EAD, we have a volunteer who's taking action. And that's how it works.
How did you set up the network in your region?
In the beginning, the start was very hard. Because the local council did hardly cooperate with us, because it was none of our business, but we were very determined, so we just continued. And in the summertime there were 3 main events in our area, and we were there as well. And we tried to make everybody enthusiastic about the things. So what we did demonstrations, we did CPR, we explained how the AED, how it worked, etc., etc. People were very enthusiastic, and within a few weeks, 5 SMEs contacted us saying, okay, we would like to buy an AED, or we would like to sponsor an AED. So there was no way back for us anymore. So that's how it started. And what we also saw, that also other groups, so like sport clubs or social clubs, whatever, also other companies were also enthusiastic, and especially sport clubs asked their members to donate for buying an AD. Also our PR activities were very important. But what we did when, for example, when an AD was installed, we just made a picture. We wrote a little story, and we set the story and the photo to the local newspaper. And everybody thinks it's great to have their name in the newspaper. So what happened? More people interested. And so that's how we set up the system. On the other hand, what also important was to set up the training of the people. We do the training via the 8 involved first aid groups. And what we do in the beginning of the year, we ask them for dates for the courses. And when we have them, we send all the volunteers in our system. We send them an invitation and ask them to go to our website and to apply for one of the courses. Sometimes we also need to send them reminders, but that's the system. That's how we work nowadays. The course is not free of charge, but the people can claim it by most of their healthcare organizations.
What is your experience being part of the National Responder Network?
I would like to make a distinguish between network as a system and network for partners, because that's different. Talking about the system, at the moment I'm very happy with the present system. A few years ago there were 2 systems here in the Netherlands, in the west part and in the east part, and we all know that that's not working. So I was very pleased that a few years ago the new system was introduced. And what we also did, we tested the system together with our, say, 911 in our area. And it worked. So from there on, we are very happy. Of course, there's a large list of wishes, but that's good when you have that. On the other hand, I'm also a member of the focus group. We discuss news, developments, etc., etc. That's good. We do that 3-4 times a year. So therefore, I'm involved. And what I do know, and I'm very pleased about that I know that the management is very keen, or they have the main focus on development. And that's what we all need. Network of the partners, I think that's great. It's always good to share each other's ideas. Of course, we started 50 years ago, so we have some experience. We can advise other partners. We can help them with things. Everybody has his own ideas. Of course, it would be great when everybody's working like this in the same way, but that's not going to happen. What we also have on a yearly basis, we have a partner event. We meet each other, and it's good to know each other. So therefore, I think also a network like this is very important to all of us.
What challenges do you experience as a local partner?
We have two very important challenges. One of them is finding the cash for maintenance and replacement of the AEDs. And the second challenge is how to keep our volunteers motivated to follow a refreshment course each year. Talking about finding the cash, what we do after 10 years, we would like to replace the AEDs, especially the ones who are 24/7, because we don't want to take the risk that in case of an emergency call, that AED isn't working anymore. So that's what we do. And what we experience is that companies are hesitating, and also sponsors are not able or not willing to give us another sponsorship. So that's a problem. And on the other hand, also people tell us it's your duty to find funds. And of course, it would be great if the Dutch government is saying, okay, I have sufficient funds for on the first hand the system, the network system, and on the other hand also funds available for the replacement of AEDs. But we also know that that's not going to happen. It's a pity, but that's the case. So that's really a problem. The second one, keep people motivated. What we often hear from our volunteers is, okay, I know how to do CPR by now, and why do I need to follow another course? And also the guidelines didn't change at all, so don't bother. And I don't want to have another training. There's no need for that. And as an instructor, I also know that the skills decrease within a few months. So, to my opinion, it's really important that they do that. So that's a problem. At the moment, we don't have solutions for our problems, but we just keep on trying.
How do you see the future of the network?
I really hope that, suppose that we see each other again in 10 years' time, that the system is still working in a very good way, that we have enough volunteers in the whole country, and that we have enough AEDs available 24/7. I think that's our main goal, but I think that's for everybody.
Citizen responder programs are a relative new discipline. Slowly, more and more research is becoming available on the overall effectiveness. But little is yet known about best operational practices for different regions based on their geographical and demographical characteristics. Therefore, it is important to measure and evaluate existing real-time data in the responder programs. I will now give you some insights into an analytical tool that we use to measure and evaluate the Dutch responder system. We use it to track the progress of the system over time, and we will also use it to identify key indicators for different success factors in different regions. In the dashboard, we see different types of KPIs related to the alert system. First of all, we have insights into the capacity of the systems. For example, how many alerts and how many active volunteers are within the system. Second, we know something about the response times of the responders. We track both the first response and also all positive responses. We also look at the incidents. There we look at the percentage of volunteers that are found and accepted, the percentage of AEDs that are found and are retrieved during an incident, and also the incidents where the CPR is started by a volunteer. Finally, we look at the distances. How far were the volunteers that were found and accepted, and the same for AEDs. With this data, we can map it out over time and see how we are progressing within the system. Interestingly, we see during the corona crisis that we have made changes to the system, and we see that in the data, for example, in the distance of the volunteers and the AEDs. Based on this data, we can find interesting trends and map them out over an average day or average year. For example, here we see the number of alerts on an average year and also the number of times that a volunteer responded. By comparing regions, we can get an insight into what are the key performance indicators. When we look at the percentage of incidents where the CPR was started by a volunteer, and we compare the highest marks with the lowest marks, we can see where the difference lies. Is that an acceptance rate, number of volunteers, average distance, or number of ADs? This can also be used to compare different types of regions, rural versus urban. A challenge in any citizen responder alert system will be to have enough ADs available within the system. This is key information for municipalities that want to upgrade their AED program, and therefore we track the location and the cardiac arrests within a municipality. On the map here, we see with the red dots the historical cardiac arrests. In gray, we see the AEDs that are temporarily available. For example, AEDs that are in a store and only available during working hours. The orange circles are the AEDs that are available 24/7. With this type of information, a municipality can make informed investments into the expansion of their AED network. We also collect data on individual incidents. We of course know the number of volunteers, but also who responded, how far they were away, the AEDs and how far they were away. The response times, both the fastest who accepted and also the average response times from all the people that had a positive response. Finally, it's important to know what happened during the incident. That is both to ensure that responders are not negatively impacted by an incident, but also to learn what actually happened and where we can improve. We ask responders to fill out questionnaires so that we can learn more about the incident. For example, we know how they went to an incident, by car, bicycle, on foot. We learn why they did not go if they were not able to go. But we also know things such as who resuscitated. Was that the citizen responder, a bystander, or the police, or the ambulance? We also learn, if there was no resuscitation, why there was no resuscitation. Finally, we'll also learn what happened with the AED. Was there an AED? If so, who connected the AED, and was the AED used to shock? It's of course important to work with research partners to enhance this initial data that we have gathered and include data points from hospitals or dispatch centers. That way we can create a holistic picture. In the next years, we will continue improving the system and keep raising the survival rate in the Netherlands. I would like to thank you for your time and hope that you have found some new ideas in this video that can help you. Thank you.
Thank you, Tom, for that very compelling presentation. That was great. We have some questions from our audience. Why don't we discuss those? Have you considered recruiting businesses, for example, delivery services with vehicles that are roving in the neighborhoods as a part of your program?
Yes, definitely. We are always looking for different services to connect with to enhance the program. One of the projects we are currently working on is the Lifesaver program, which is an initiative with Philips and Volvo together, where we include AEDs in Volvo cars and we can directly alert people in the cars and direct them to an incident. Currently, we are running pilots in different areas in Europe, and the first results are very promising with faster response times of up to 2 minutes. So we're really looking forward to expanding that program further.
Okay, that's fabulous. We have another question from our audience. If a volunteer does not complete their training, are they removed from the application?
They are not removed, but they are deactivated. So every volunteer in the system needs to follow the ERC or their local resuscitation council guidelines. When they are about, when the certificate is about to expire, they will get a reminder to tell them that they have to update their training. If they don't manage that within time, then they're deactivated in the program and they are no longer actively included in alerts until the time that they do update their certifications.
Great. Here's another question that we often get about asking for progress on more price affordable AEDs.
Maybe Satyan, you can take that one.
Yeah. So I think there is an industry-wide initiative on bringing the prices of AEDs down, but this is, of course, not one manufacturer can do this, and everyone knows AED is a class 3 medical device, so it's really going to take time to get there. But again, the initiatives in Netherlands, like this community-sponsored AEDs, that really brings the price of the AED for an individual down.
Great, thank you, Satyan. We've been asked how many lives have been saved with your program in the Netherlands, or have you contributed to saves through the program? I think you're muted, Tom.
Yes. So we don't really have any hard data on that. We're working towards that to integrate with hospitals to get direct contact with that and together with research groups. But what we can say is that we have about 30 calls on a day and over between 200 and 300 calls a week. So during a year, we handle about 10,000 calls. And studies on the system have shown that we can increase the survival chance by at least 10%. So if you calculate that down, then we save about 1,000 lives now already per year. And we're, of course, working very hard to get that number up by expanding our AED network and making the system still more efficient.
Great. We have another question from the audience asking about the coverage of AEDs. Are you having any spots where you're lacking in AED coverage? And then they would also like to know if you include all manufacturers' AEDs in your registry.
Yes, so during the video, it was already said that the big next challenge in the Netherlands is to complete the AED coverage. So we have still about 1,600 blind spots, as we call it, where we actually would like to have a 24/7 available AED. And that way complete the whole map. Now the STAN platform is completely vendor agnostic, so we include all AEDs. Of course, they have to meet certain quality requirements, and usually we look at an FDA approved AED to be included in the system.
Great. Another question, what are the possibilities of adapting the program to other countries?
So the program itself, the technical part, it's a SaaS solution. That means that it's in the cloud and it runs on a server, and you can connect to it from any place, and we can place it on any server. And then, of course, it depends a little bit. As you see, there's a technological component, but there's a very big program component on it where you need many different stakeholders to implement it. So I think the technology part is the easy part. And the real rollout and setup of the program, that is really where the challenge lies. And that depends really on the country, how far a country is, how far they are with CPR training in a country, the AD network that they have, etc. But we are already active in many different countries. So I think any country can start small and then build it up from the ground. That's similar how we did it in the Netherlands. We started with very small communities, and it took a while, but now we have a national program that covers the whole of the Netherlands.
Yeah, a very impressive program, one of the best in the world for sure. Another question has come in about new AEDs being registered. How do people tell you if there are new AEDs? And do you feel like there are some AEDs out there that you don't know about that are not in your registry?
Yes, for sure. There are many more AEDs than the ones that we have in our system. Now, in some countries, there is a mandatory, there's a law where you have to let either a dispatch center or some other health organization know when you acquire an AED. But in the Netherlands, we don't have that. So there's definitely more AEDs out there. And the second part of the question? Sorry, what was the second part of the question? I forgot the second part.
Do you feel like there are AEDs that are there that you don't know, that are not in the registry? I think you answered that.
Yeah, that I answered. And then how do we know about new ones? So what we do is we ask people to sign it up and then it comes into the system. So we don't keep tabs on all the AEDs in the Netherlands, but we ask people when they have an AED to sign it up to our system, and then we know where it is.
Couple more questions I think we have time for. Pardon the dog barking in the background. Do you have fully automatic and semi-automatic AEDs in your program?
Yes, we do.
Okay. And let's see, any more questions here? Could you talk a little bit more about the local partners that was mentioned in one of the interviews? Could you explain a little bit more about them?
Yeah, so the local partners are actually local associations or foundations that either have a volunteer group that they are managing locally, or an AED network that they have built up in their community. And these are usually very close, tied to the community, are very active within the community. They want to help the system also succeed. That's really their goal. And we enable that by giving them access to the system for their specific region and also for their specific area where they're working in. And then they can manage their volunteers or their AEDs or both through the system and have a view on that.
Great. One more question. How do you work and differentiate between rural and urban areas regarding the alert radius?
Yes, I saw that. It's a very good question. So we did a study last year, was done by the University of Twente, and they built a simulation model to see how we could optimize the alerting algorithm. And currently we don't work with fixed radiuses anymore, but we are looking for a certain amount of responders within a maximum radius. Now that means that in an area such as Rotterdam or The Hague, where we have a lot of responders, we can find the required number of responders within a range of 400 meters. When we go to more rural areas, there this can expand to 1.5 kilometers till we find the required number of responders. And so we don't directly differentiate between them, but just actually the density of your responder network will determine what kind of alert radius there is.
Great, great. Last question. Are there any links where we can read a little bit more about your program? Where would you suggest people go?
Good question. So they of course can go to our website, that's stenglobal.com. I think that's a good place to start for this. And I think you can of course visit the Philips booth during the ERC conference. They will have many more information on this, and there also the video can still be reviewed at a later date.
Great, Tom. Thank you very much. That's a perfect segue. We would like to invite everybody to the virtual ERC Philips booth, and where you can learn more about products and solution and talk to the Philips experts. I hope that everybody found the presentation to be interesting. I'd just like to say that we know that these are challenging times, and we're so glad that we were able to virtually be together for a little while and connect with you. Thanks again, everybody. Bye-bye.
Thank you. Bye.